Headaches. We've all had them, and they're no fun. But are pain relievers the answer? I'm sure you've heard that chiropractic is great for headaches, but why? Let us join Dr. George Costanza so the next time you have a headache, you can be assured your chiropractor is your best pain relief option available. Dr. Costanza?
Do you realize that 80% of headaches come from a problem in your neck? Yes, it's called cervicogenic. Don't feel bad if you didn't know. Ask your medical doctor if he knows. I'll bet you your chiropractor knows. This is a little known fact. In my practice, I find it very frustrating because patients come to me with a headache. They've had a brain MRI, a brain CT scan, they've tried several drugs. The drugs and the medicines that they're taking only alleviate the headache after it starts. Then they have to take more and more of that drug, and they have to take it more frequently. Sometimes it's making them sick, giving them side effects, so they have to take a second medication for the side effect, or maybe that medication is addictive. And the whole time, the headache is coming from the neck, and it's never been checked. I'll bet you your chiropractor knows this. We want to make sure that you know this. Please allow me to explain this. One of the most important things to your health is the alignment of your spine. You're in a chiropractor's office. I'm sure he's talked to you about subluxation, about how if the bones in the spine, the vertebrae in the spine, are not aligned or moving properly, puts pressure on a nerve. Critically important in the neck because for the most part, all of the nervous system has to pass through that neck to get to the other organs, tissues, and cells in the body. Not the place you want to have a problem. Not that you want to have this problem at all. So we'll look at the alignment of the spine. We'll talk about how it affects the nervous system and then how it causes a headache. This is a very simple principle. I'm sure you'll understand it, and I hope you get some value from this. So, from the front, the spine should be straight. Most people are. But if there's any side shift, either way, curve, head shifted to the side, your chiropractor can detect that. That'll irritate the nerves, possibly pinch the nerves, can irritate the muscles as well, and especially from the upper part of the neck, the pain referral pattern is going to be into the head. And what do we call pain in the head? A headache. Typically, with a headache, there's nothing wrong with the head. If you had a brain tumor, God forbid, and it would cause a headache, but you wouldn't be in your chiropractor's office because someone would have determined that by now. So let's look at the alignment of the spine from the side. Normally, there should be a 30 to 35 degree curve in your neck looking at you from the side with the concave portion of that curve in the back of the neck. Now, vertebrae, those are the white bones, and then the green things here are the discs in between. Important to understand that the disc has a gel in the middle, and if you squeeze gel, just like when you played with Play-Doh when you were a kid, or when you made meatballs as an adult and you squeeze, the jelly is going to come out from in between your fingers. When you squeeze the disc, the jelly is going to look for a place to go. Understand one more thing. There's little nerve endings, and a lot of them, in the outside rim of that disc, and they're sensitive to pressure and they're sensitive to pain. So, if your head is carried forward, or if you don't have enough curve in your spine, with some patients it gets so bad the curve actually goes backward. Extremely painful. But as you can well tell, all of that pressure goes to your discs. And the discs expand, ignites those pain-sensitive nerves, and guess where the pain gets referred? A lot of it gets referred to your head as headache. There's research studies backing this up. That's where I learned it. This is not my opinion. But the upper 2 to 3 cervical discs, when they have pressure on them, refer pain to the head. Do you know how they found out? Someone volunteered for this. I wouldn't have, but they injected fluid into those discs to increase the pressure and annoy the disc, and then asked the patients what they felt. And a great number of them said, I'm getting a headache from this. That's why we know that the discs in the upper part of the cervical spine can cause a headache. Your chiropractor knows that. Now you know that. So please talk to him about it. The other problem with not having enough curve or having forward head posture is that when there's a lack of curve here or forward head posture, it's been proven that it tethers your spinal cord. Tethering means it gets pulled side to side, like when you're pulling on a rope. You don't want that to happen to your spinal cord, because if you irritate your spinal cord, you can cause almost any health problem to occur. You can affect your immune system, your respiratory system, of course your muscles, of course your nerves, your digestive system, your hormone system. It can all be affected. So you don't want forward head posture. You don't want a lack of curve in your neck, because besides the headache, it causes other problems. The last thing it'll do is it'll cause advanced disc degeneration. Your discs were designed to last 100 years. I have patients that come to me with disc degeneration in their neck, and someone told them, it's because you're getting older now. But if you look at the x-ray, they have 1 or 2 discs that are degenerated, and the other ones are perfectly healthy. I tell them, that disc there looks like you're 20 years old. This one here looks like you're 70. Well, they're all the same age, so they should all be affected the same way. Why is one affected more than the other? Because the bones are out of alignment, because there's not enough curve, there's an improper curve, there's forward head posture, but there's something affecting that disc, and that's why it aged quicker. So, to sum all of this up, if you're suffering from headaches, speak to your chiropractor. If you have a friend, a family member, a coworker, colleague, someone you play softball with, and they suffer from headaches, please tell them they don't have to keep taking that dangerous medication. Have them speak to your chiropractor. Maybe you can make a difference in someone's life.